I'm Judy Unruh, and I live in Yukon, Oklahoma. Born and raised Oklahoma girl. Went to school in Western Oklahoma and married and moved to Oklahoma City and been here since then. I had the knee replacement the latter part of November, right after Thanksgiving, and spent 3 days in the hospital. And at that point in time, they told me to just go home and not try to do any exercises for a while. So I was at home and was able to, just be up and around a little bit, but enough that I could get from my bed to the bathroom without any problem. Well, on December the 23rd, about 3 weeks later, that's exactly what I was doing. I got up and went to the bathroom, and as I got out of bed, the knee just gave away on me, made me fall, and I heard 2 cracks, and I knew something was terribly wrong. So called the ambulance, went to the hospital, confirmed a femur fracture. It was a spiral fracture, so it was quite involved. And at that time, this was a Sunday. So my doctor, Christmas weekend, of course, my regular doctor was out of town. So I got one of his partners from his office came in and said that he was going to do the constructive surgery. And he didn't know for sure what he would have to do till he got in there. But once he did, and it was all over with, he informed me that he had put a rod up through the femur and had put nails at the top and the bottom, and that the rod had actually caused the femur to crack just a little bit at the top. So that was a concern. But at 3 days in the hospital again, no weight bearing whatsoever, couldn't move the leg at all. He told me that I would need extensive assistance and asked if I was ready to do that at home. And I said, well, no, because my husband works and there's no one else there with me. And he said, well, let's be thinking about where you want to go. He said, I'll have the case manager come and visit with you, and we can work on that. So I think it was the second day, the case manager did come in and said, what do you plan to do when you leave here at the hospital? And I said, well, I'm assuming I'll go to rehab or skilled care for a while till I can get up and walk again. And she said, well, do you have a particular place you want to go? And I said, yes, I want to go to a favorite place of mine that I'm familiar with. And she said, well, I don't think you can get in there. And I said, yeah, I think I can. I know some people that will help me. So we did, and was discharged on a Friday. That was a disaster in itself. The day of the discharge, the doctor did not come in to see me, just his PA. And he wrote out scripts, really without talking to me or asking me about my previous medication regimen. And he just wrote out more or less what I'd been on there in the hospital. And then he told me to come back and see my doctor in approximately 4 to 6 weeks. That was it. Never saw the case manager again, nothing. The healthcare facility that I went to, the rehab, actually arranged for my transfer to their facility. So I got out there, all was well, got into the room and settled and the whole thing, and I was there 6 weeks. But right at the get-go, I was still having quite a bit of pain, and come to find out, the doctor had ordered 2 different pain medications for me. Neither of them had arrived by the time I got to the skilled unit. So I didn't have anything for pain for a while, and that wasn't very good. But then when they got it in, they were giving me both of them, one at night and one in the morning, and that's not what was supposed to have been done. But anyway, we got that settled and straightened out. Therapy was good. They came in and worked with me. I was limited as to what I could do because of the non-weight bearing status, but they did encourage me to get up and get around in a wheelchair and come into their therapy class, and I did all of that. Well, at about 3 weeks, I knew I was supposed to go back and see the surgeon, and didn't have an appointment. No one had made one. I started asking the nurses, what about this? Can we call? Whatever. Well, when they did try to call, the doctor or his office was very negligent, I guess you could say, in getting back with us. You can't ever talk to one immediately when you call. So that took approximately 4 to 5 days before we could get an appointment scheduled, but we finally did. So I went in and I saw the doctor that did the surgery, and he said, well, you don't need to come back and see me for another month, but I do want to see you then. So I said, okay. So went back to the skilled unit. In the meanwhile, my regular doctor that had done the knee replacement to begin with had set up an appointment for me when I left the hospital from the knee surgery. So they called and wanted to know why I wasn't there, not knowing that I was still supposed to keep that appointment or whatever. So we set up for the next day, and I went back and saw him, and he said, well, you don't have to go back and see the doc that did your surgery. You just stay with me and come back and see me as we set appointments up. So that's what I did. And I asked him about when I could go home. This was 5 weeks in. He said, well, I really don't want you to try to go home until you can at least stand with minimal assist of a walker. And then I think you could probably handle yourself at home. So I said, okay, I'll give myself another week. I was pretty anxious to get home. So I did stay another week. Then when I left the skilled unit, I know it's probably not a routine thing for them to be this intensive with their discharge planning, but some things that fell through the cracks for me was incorrect dosages on my medication when I was discharged. No follow-up appointment was made for me when I was discharged. No offer of home health to come by and check on me or anything like that was even discussed with me. It was just, here, sign this paper, you're discharged. So once I got home, got the prescriptions filled that they did write out for me. The meds that I had usually taken were not written at all. They were still at the pharmacy on a routine refill. So I got the scripts filled that the rehab unit sent with me. And then the very next day, the pharmacy called, knowing I was back home then, and said, you have 4 more meds to pick up. So some were duplicates. So the pharmacy wasn't involved either with what all had happened with me. And I don't know whose fault that is, if I could say fault. To me, there should be some type of communication between the discharge from the skilled unit and the local pharmacy that I'm going to be using. When I was in the skilled unit, the main person that saw me was a PA, who was great, met all the questions, answered all the questions. The physician did see me personally one time, and then I saw him out in the hallway and visited with him just because we're personal acquaintances. So all in all, I got very good care, but there's just a lot of things in that discharge process from the hospital and from the skilled unit that I think really needs to be worked on. Once I was ready to be discharged from the hospital, the PA came in and discussed with me what I was going to be doing and said, I will send prescriptions with you to the skilled unit. He didn't tell me what they were. He just said prescriptions. So once I got to the skilled unit, I asked if the meds were there and what they were. I personally asked them that. And they said, well, some of your meds are here and some aren't. So the pain medications was one thing that wasn't there because they have to have a written script. And the doctor had not done that at the hospital. He didn't send a written script for pain medication. So anyway, that was a kind of a hassle to get that all straightened out. But then when I left the skilled unit to go home, all I was asked about my medications was how many days or how many months refills do you want? How many times do you want it written to be refilled? And I assumed that it was going to be the normal meds. When I was admitted to the unit, I had to write down all of my routine medications, dosage, and how often I took them. And I did that at the hospital as well. So they had record of everything that my normal meds were. When I got home, those same meds were not there. The dosages had been changed. One had completely been changed to a different type of med. And no one talked to me about that. No one asked, if that was okay or if I thought that would work. And when I did go home, my husband picked up the meds from the pharmacy, so he didn't know the difference. So it was only after he got home with the meds and I looked over them did I discover that there was quite a discrepancy with what I had normally taken and with what I had taken in the skilled unit. No type of communication was received by my primary care physician, even though every place I went asked me for his name, his address, his phone number. Who was this man? But he did not get one word. He didn't get an op report. He didn't get a discharge report, nothing. So when I did go back to see him about 2 months later after I got home, he knew very little about what all I had gone through, and I had to sit there and go through the whole story with him. So that's kind of a disappointment as well, that there's not a better communication there. Another problem that I faced while I was in the rehab unit was lack of lab results being shared with the unit. Because the hospital did not send copies of lab results, I had to be stuck or have blood taken on 3 different occasions for further lab work that I had already had while I was in the hospital. So that's another unnecessary detrimental thing for the resident to go through. Well, one thing that I would like to see change in this whole scenario, if a rehab unit knows they're getting an admission from the hospital, normally they know a couple of days in advance. So if there could be a nurse or maybe even a ward clerk or a therapy person come up to the hospital, visit with the resident, see what the orders are on the chart, talk with the charge nurse there, and perhaps come up with a discharge plan where all the medications are listed, any special precautions are listed. For example, I was supposed to keep this immobilizer on all the time. That wasn't anywhere in my orders. I had to tell them, no, you can't take that off. No, I can't move or bend my leg, whatever. So if some type of situation like that could be formulated, to me it would just be a tremendous benefit for the facility as well as the patient. And then that same person could be involved in their discharge to home because she's followed them. It's kind of like a case manager, but not to the detail that case managers work with most people. Just enough to get them settled into the facility, into the rehab facility, and then settled at home. Well, I think each facility has some type of discharge form that they use. In this day of computers, something like that could be set up very easily that would tell all of this significant data about the resident or the patient, their surgery history, the medications by all means, any restrictions or special rehab or therapy that they're needing, family involvement. Is there a family? Is there someone in California? Those types of things to me are just so important to know when you get a resident coming into a facility. My mother-in-law did have very similar problems with some of her medicines and treatments and follow-up care at home. So between she and I, these aren't isolated instances. I know, as a matter of fact, that this happens all the time. And there's very significant problems that arise due to the lack of communication and the lack of talking and preparing a discharge plan that is known by the family and the resident. So we really need to work on this cooperatively between the hospitals and the rehab units, nursing homes, whatever, even back to the home setting. There needs to be a consistent information sharing way to do things. You know, a good change that we need to see made is that we think of these things from the patient's perspective. Because I was a patient, and I was there, and I know how I felt. You may think that you know everything there is to know, but I promise you there's things that come up that you don't have an answer for, and you need to be able to go to someone that can answer them for you or can get whatever you need accomplished, and that just doesn't happen now on a routine basis. So we really need to have people who are advocates for the patient, meets their needs, and goes to bat for them if something comes up. You know, if they get a medicine ordered from the doctor that they don't want to take, that nurse ought to be able to call that doctor and say, Judy doesn't want to take that medicine. She's had it before and it doesn't work for her. And the doctor should listen, hopefully. Now, I say all this because I want to prevent someone else from having to go through these problems. I'll tell you now that I am a nurse, and I have been in long-term care for 30 years. So I know all the ins and outs, and I know what should have been and not been. And still, even with my knowledge and the people around me knowing who I am, these things still happened. So someone that doesn't have a background or doesn't have family members with medical knowledge could really be in a predicament if things aren't explained to them exactly and followed up with once they do get home. So that's a major concern for me.